Affordable healthcare and access to appropriate innovative technologies is still a dream for many. More than 2 billion people have inadequate access to care, and around 9 million children die each year before age 5. While there are more than 10,000 known medical devices, the most affordable and appropriate for low-resource settings are the least likely to reach all who need them. Many clinics, hospitals, and labs in the developing world are now equipped, if at all, with second-hand devices that may not be useful in their settings due to lack of reliable power, parts, and technical support. The UN convened its first ever meeting on medical devices just 5 years ago. This attention converged with several other key trends, including selling to the bottom of the pyramid, the widespread development of university programs in biomedical engineering and poverty alleviation, and the growing impact of social venture funding. As the demand for biomedical engineers is by far the fastest-growing segment of the job market for skilled professionals, device innovation will only accelerate. At this intersection of need and opportunity, BioMedLink is poised to make a difference that matters. We aim to improve access to innovative, affordable devices in low-resource settings by developing a comprehensive interactive database, providing user feedback to device designers, encouraging innovation by linking innovators with users, funders, and manufacturers, and connecting stakeholders along the entire supply chain so that effective products are put into use more quickly. Creating greater access is the goal. BioMedLink can assist device innovators secure rights to their IP, help IP holders find appropriate manufacturers and vice versa, make critical connections to distributors, and increase the availability of appropriate products to end users. Significantly, we will also enable feedback from users to innovators, providing invaluable design information that will result in more effective products for all. Funders, governmental organizations, and NGOs will be able to glean valuable information from our database, user feedback, and mapping functions so they can track deployments of specific devices in entire categories, immediately see where devices are concentrated and where additional support is most needed. We aim for BioMedLink to be adopted as a global standard by the World Health Organization, the UN, and the World Bank. A searchable database on the net also means that even in a disaster, appropriate devices can be quickly sourced and deployed. My experience at Global Rock was inspiring. In 2 days, an idea I'd been incubating for 6 months morphed into a real-world solution. Amidst open-source advocates, I saw that the solution to this seemingly intractable problem involves assembling existing code in a new way. It's way past time to open what's now a closed-source system. I received many offers of support from supply chain code to mapping tools to user feedback and sales modules, as well as the offer of a personal introduction to Muhammad Yunus. I left feeling acknowledged and appreciated and encouraged for the road ahead. With more than 15 years in global public health, I can move this forward quickly with established contacts and credibly approach new ones. The amazing BioLink team to date includes fellow rockers Leisha Sterling, Arazu Sarvastani, and Andrew Valish. Since 1979, I've been an independent consultant bridging the gap between aspirations and operations through strategic communications, organizational design, and leadership development in healthcare, technology, and their intersection. My passion for global public health was sparked when I met the remarkable founder of the pioneering Aravind Eye Hospital and became a consultant to his leadership team. Since then, I've advised startup health NGOs and am a mentor for the Global Social Venture Competition. Participation in the Accelerator would offer us invaluable technical support, sounding boards, and milestones to ensure we stay on track. While I have a lot of experience on the business side, I wrote the business plan for a startup that became a $75 million company. I appreciate how different it is to be a founder. I would enjoy offering whatever I could to other teams in the program. As my mentor said, intelligence and capability are not enough. There must be the joy of doing something beautiful. I've been so moved by the spirit of generosity I experienced at Rock and enthusiastically look forward to becoming a more integral part of this wonderful community. Your support now could improve the lives of millions. Thank you for your consideration.